How much do we really know about the silent battles many teenagers are fighting with their bodies and minds every day? It's a question that might catch you off guard, but it's one that needs to be asked. Every day, countless teenagers are struggling with eating disorders like anorexia, bulimia, and binge eating, often in silence and isolation. These are not just passing phases or simple choices, they are serious, life-threatening conditions that require understanding, compassion, and effective interventions. Awareness is a powerful tool in this battle. It's not just about recognizing the signs and symptoms, but also about understanding the root causes, the devastating impacts, and the potential paths to recovery. We need to understand to empathize to support, and to support to help heal. So let's strip away the misconceptions and stereotypes. Let's shine a light on the reality of these disorders. In the next few minutes, we will delve into the world of eating disorders amongst teenagers. The first eating disorder we will discuss is anorexia nervosa. Anorexia nervosa, often simply referred to as anorexia, is a serious and potentially life-threatening eating disorder that is characterized by self-starvation and excessive weight loss. It's a complex condition that intertwines the physical with the psychological. The symptoms of anorexia can be diverse and not always immediately obvious. They include an intense fear of gaining weight or becoming overweight, a distorted body image, and an extreme preoccupation with food, dieting, and body size. Individuals with anorexia may also engage in behaviors such as excessive exercise, self-induced vomiting, or the use of laxatives to lose weight. So, what causes anorexia? It's not entirely clear. It's likely a combination of genetic, biological, environmental, and psychological factors. It's important to note that anorexia is not a choice. It's an illness that can affect anyone, regardless of age, gender, or background. Anorexia can have severe consequences on a teenager's life. It affects not only their physical health, but also their emotional and social well-being. Often, teenagers with anorexia isolate themselves from their friends and family, and their academic performance may decline. They may also experience anxiety, depression, and other mental health issues. Physically, anorexia can lead to a myriad of health problems. These include heart complications, bone loss, anemia, and in severe cases, it can be fatal. The body, starved of essential nutrients, begins to consume its own tissues to survive, leading to a slow but steady decline in health. In the face of anorexia, it's crucial to remember that early detection and intervention can significantly improve the chances of recovery. If you or someone you know is struggling with symptoms of this disorder, it's important to seek help. There are numerous resources and support systems available for those battling anorexia and other eating disorders. Anorexia nervosa, a silent enemy that slowly but surely destroys the body. Next, we move on to another common eating disorder, bulimia nervosa. This disorder is often characterized by a cycle of eating unusually large amounts of food, also known as binging, followed by behaviors that compensate for the overeating, such as forced vomiting, excessive exercise, or extreme use of laxatives or diuretics. This behavior is typically driven by a distorted body image and an excessive fear of gaining weight. Bulimia nervosa can affect anyone, but it's particularly common among teenagers. This is a critical period marked by rapid physical changes and increased social pressures, creating a fertile ground for the disorder to take root. The causes of bulimia are complex and multifaceted, involving a mix of genetic, psychological, and environmental factors. It's not simply about food or wanting to be thin, it's a way of coping with emotional pain, stress, or self-esteem issues. The effects of bulimia nervosa are both physical and psychological, and they can be devastating. Physically, repeated binging and purging can lead to electrolyte imbalances that can cause irregular heartbeats and even heart failure. It can cause gastric rupture, tooth decay, chronic irregular bowel movements, and inflammation and rupture of the esophagus. Psychologically, bulimia can lead to an overall decrease in quality of life, social isolation, and severe mental health issues such as depression, anxiety, and substance abuse. People with bulimia often feel shame and guilt about their purging behavior, leading to a vicious cycle of emotional distress and further binging and purging. It's important to note that bulimia, like all eating disorders, is a serious mental health condition. It's not a lifestyle choice or something that can be overcome through willpower alone. It's a complex disorder that requires professional treatment. If you or someone you know is struggling with symptoms of bulimia, it's crucial to seek help from a healthcare professional. Bulimia nervosa, a hidden cycle of harm that can be devastating. But remember, it's not a hopeless situation. With the right help and support, recovery is absolutely possible. Now, let's shine a light on binge eating disorder. Imagine a roller coaster, the thrill of going up, the tension at the peak, and then the rapid, almost uncontrollable descent. That's binge eating disorder, or BED, in a nutshell. But instead of a roller coaster, it's a cycle of overeating and intense feelings of guilt. BED is the most common eating disorder in the United States, yet it's often underdiagnosed and misunderstood. It's not just about eating too much. It's about feeling out of control during these episodes, eating quickly and to the point of discomfort, even when not physically hungry. What triggers this vicious cycle? Well, it's typically a mix of genetics, psychological factors, and societal pressures. A person with BED might have a history of dieting, a family history of eating disorders, or struggle with feelings of depression, anxiety, or guilt. Society's emphasis on thinness and diet culture can also play a significant role. The effects of BED are far-reaching. Physically, it can lead to obesity, heart disease, and type 2 diabetes. Emotionally, it's linked to feelings of shame, isolation, and low self-esteem. But perhaps the most damaging effect is how it can consume a person's life, making it difficult to focus on anything else. But here's the thing. Recognizing and addressing BED is crucial. It's not a phase or a choice. It's a serious mental health disorder. The good news is that it's treatable. Cognitive behavioral therapy, interpersonal psychotherapy, and medications have all been shown to be effective. The first step, though, is understanding. Understanding that BED is not about lack of willpower or self-control. It's about a complex interplay of factors that are often out of a person's control. It's about recognizing that it's okay to reach out for help, to break the cycle, and to seek a healthier relationship with food. Binge eating disorder, an overlooked issue with serious implications. Understanding these disorders is crucial, but what can we do to support those who are struggling? Eating disorders like anorexia, bulimia, and binge eating aren't simply a matter of choice or willpower. They're complex mental health conditions that affect individuals on multiple levels, physically, emotionally, and socially. That's why understanding and support are two of the most vital pillars when it comes to helping someone navigate through this tough journey. Let's start with understanding. It's about seeing beyond the surface, beyond the behaviors, and recognizing the pain and struggle that lies beneath. It's about educating ourselves on the realities of these disorders, dispelling myths, and breaking down stereotypes. And it's about listening, truly listening, to the fears, the insecurities, the hopes, and the dreams of those affected. Support, on the other hand, is about action. It's about providing a safe, non-judgmental space for them to express their feelings. It's about offering a helping hand, whether that's in finding professional help, accompanying them to therapy sessions, or simply being there for them in their moments of need. It's about showing empathy and compassion, even when it's hard, even when you don't fully understand what they're going through. But here's the thing, understanding and support don't just come from close friends and family. They also come from society at large. From the way we talk about body image and beauty standards, to the way we approach mental health in our schools, workplaces, and communities. We all have a role to play in creating an environment that fosters recovery, not just for teenagers with eating disorders, but for anyone grappling with mental health issues. So what can you do? Educate yourself, listen, show empathy, offer help, and most importantly, be patient. Recovery is not a straight line. It's a journey filled with ups and downs, progress and setbacks. But with understanding and support, we can help make that journey a little less daunting. Remember, it's not just about understanding, it's about reaching out, it's about supporting. We've covered a lot of ground today, so let's take a moment to reflect. We've delved into the complex world of teen eating disorders, shedding light on anorexia nervosa, bulimia nervosa, and binge eating disorder. Each of these conditions is unique, but they all share a common thread. They are serious, potentially life-threatening conditions that require understanding, empathy, and professional help. Anorexia nervosa, characterized by an intense fear of gaining weight and a distorted body image, can lead to severe health complications if left untreated. Bulimia nervosa, on the other hand, involves cycles of binging and purging, causing both physical and emotional damage. Lastly, binge eating disorder, marked by uncontrollable eating episodes, can lead to obesity and related health issues. These disorders are not about vanity or a lack of willpower. They are real, serious health conditions that affect millions of teens worldwide. Remember, every teenager deserves to feel happy, healthy, and accepted. Let's fight eating disorders together.